Right, hello, it's Andrew Picken, Royal Wellness from Chesterfield Royal Hospital, and I'm delighted to have Hayley with me. Hello, Hayley.
Hello.
Hiya. And today we've discussed lots of topics on this channel. We're going to discuss support in stopping smoking with your service. But I suppose before we go into the formalities of that, how are you doing?
I'm good, thank you. Yeah, it's definitely strange during these COVID times, but it's been really exciting with the Quit for COVID campaign that we've got going on at the moment. Hopefully, encouraging people to stop smoking during the COVID pandemic.
Right, and I suppose in some ways, me as well, and I know a lot of people across our trust, it has taught us different ways of working, you know, virtually. And I suppose the Stop and Smoke service may allow you to access more people and promote what you can do to help people give up smoking, the benefits it brings. Definitely,
yeah, we've seen an increase in people accessing our service through our self-referral and ringing our service during COVID and really taking notice of their health and wanting to stop smoking because of respiratory conditions caused by smoking, which can make you have a worse effect of COVID, which it's no better time to stop, really.
Yeah, absolutely. And, you know, just tell us some about some of the health benefits and financial savings you can make if indeed you take up your service and give up smoking.
So I suppose the biggest thing to notice to start with is that stopping smoking is the best thing that you can do for your health. It's #1 thing that you can change in your lifestyle to stop smoking and access stop smoking support. On average, the life expectancy of a smoker is 10 years less than a non-smoker, and this is because of the ill health caused by the result of smoking and smoking related illness. So it's the best thing that you can do. There's carbon monoxide and lots of chemicals in cigarettes. So there's over 7,000 harmful chemicals, which is phenomenal. Things like tar, which is found on road surfaces, methane, like in rocket fuel, and things like nicotine, which is the addictive part of smoking, and the carbon monoxide. So don't know whether you know much about carbon monoxide, Andy, yourself.
No, I don't really. I know about carbon monoxide testers in houses and the ported gas appliances, but I suppose what you've just said then is everybody knows about nicotine, or most people do, but I suppose you don't realise about carbon monoxide, methane and the concoction of other chemicals that are involved. Surprising.
Yeah, so nicotine's not the harmful part of smoking, it's the addictive side of smoking. Nicotine itself isn't the harmful part of smoking, it's the addictive part, which is why we use nicotine replacement to help people to stop smoking. But it's all the other chemicals and harmful things in cigarettes, and carbon monoxide is that invisible gas. So like you talked about with faulty boilers, you can find that people can get carbon monoxide poisoning, and it's the same time every time people are smoking and taking in that carbon monoxide, which takes the place of oxygen in the bloodstream. So oxygen can reduce by up to 15% if you're a smoker. So when people stop smoking, they suddenly get a lot more oxygen and start to feel healthier so much quicker, because your carbon monoxide reduces after around 24 hours after quitting, which is a really quick difference that you see.
And I think that's interesting, isn't it? Because when we're talking about quick wins with other lifestyle measures like, you know, losing weight or fitness, you know, you're not going to get necessarily a benefit in 24 hours. Well, you are, obviously, there's a benefit to it, but you're not going to see a tangible benefit. But what you're saying with smoking is at least 24 hours, then that rolls into a day, 2 days, a week, a month. You can instantly see that the body's saturating more oxygen. You know, it's generally improving really quickly as well.
Yeah, that's right. So we always say to people, it's never too late to start smoking. We've had people even in the 90s coming through our service and saying, look, I really want to stop smoking. And it's never too late to see those benefits of stopping. However long you've smoked for, you'll still see those benefits. So and you'll notice those benefits straight away. So after 20 minutes, the blood pressure returns to normal. And after an hour, circulation starts to improve because of that improved oxygen in your bloodstream. So that your hands and feet start to feel a lot warmer. Often people describe it as feeling like pins and needles in the hands and fingers, in the hands and the toes, that because it's an increase in circulation, and the oxygen's getting around the body a lot quicker. And then 8 hours, carbon monoxide levels start to fall and blood pressure returns to normal. So a lot of the time people think that smoking helps with stress, for example, and use smoking as a stress reliever, but actually it does the opposite. It increases your blood pressure and makes you feel a lot more stressful, and makes, for example, nicotine as well is addictive. So you're wanting to then have that next cigarette, and it's a cycle that your brain goes in. Once you see that fall in nicotine, you then want to have another cigarette. So it's cause of stress a lot of the time.
So if you've got this this cycle that you can get into, so you're stressed, you have a cigarette, it makes you want more, the nicotine's addictive, and then you've got this concoction. I'm envisaging a cauldron with 7,000 chemicals in that we're steering, and it's doing horrible things to your body in terms of blood pressure, oxygen levels. So in terms of the support that you as a service offer in Derbyshire, which I think is really keen, it's fantastic what you do. Do you just want to go through some of the available support that people can access? Yeah,
of course I can. So smokers are 4 times more likely to stop smoking if they access behavioural support and nicotine replacement. So there is a local stop smoking service in Derbyshire. We're called Live Life Better Derbyshire. We're part of a holistic lifestyle service. So we provide weight management, stop smoking, and physical activity for people living in Derbyshire or have a Derbyshire GP. And research shows that without smoking cessation support, only 4% of attempts to quit tobacco would actually succeed. So that just shows the importance of accessing the support. And if you've not accessed support before, it's always worth having a go. And if you've accessed support before and it hasn't necessarily worked, every quit attempt's different. And we find that people coming back to the service just using a different product, just a different time in their life, can then successfully quit smoking. So we have a 60% quit rate in Live Life Better Derbyshire. We provide a 12-week support programme to help people to stop smoking. We use a combination of different products. So we use nicotine replacement, and we've got access to Champix as well, which is a stop smoking medication to help people quit smoking. So we get that on prescription through people's GPs to help them to stop smoking. We are an abrupt quit service, so we help people to set that quit day when the quit day that's right for them. So on that first session, we talk about routine changes and how we can support people to stop smoking and set the quit day that's right for them. We don't do a cut down to quit, because we find that if people cut down, then they really enjoy those last couple of cigarettes. So we find that they're taking deeper inhalations on the cigarettes and actually getting more and more out of those last couple of cigarettes, and then find it really hard to completely get rid of them. So we go for an abrupt quit, which is the advised way of quitting smoking, and then we use the products from the date of quitting, or Champix. We set your quit day between days 8 and 14 of the medication. At the moment, just to kind of give you an idea of the service of how it's operating during COVID, we aren't doing any face-to-face support because of the restrictions, but we are doing one-to-one support either over Skype or over the phone, as well as providing that digital support offer as well for people to stop smoking. And we post out the nicotine replacement, so you can still access nicotine replacement to help you to stop, and it comes right to your door through the post, which is a fantastic initiative that we've got in Derbyshire to help you to stop. And you can access support whether you're working, whether your children are at home at the moment. So it's a really good opportunity to stop smoking. There's no excuse to think I haven't got time. We've got lots of clinics at different times of the week, different days of the week. So it's all good to be able to access our service at the moment.
So it's almost like a personalised service. I mean, from what I'm hearing, it's so accessible. It gets posted to your door. You've got different times to fit around family needs, and you acknowledge that as well, don't you? It's not just being a dictatorship, isn't it? People know they should be giving up smoking, but actually it's really hard to give up. So you're offering that support, and I'm assuming, like the other groups in public health in terms of weight management, I've seen all sorts of things. I've got Facebook support groups. I don't know whether you've got that. So there's an online community of different people that are going through the same thing, difficulties, challenges and wins as well. So it's good to share wins, isn't it? I actually went so long without a cigarette, I'm feeling better. That peer support's really important.
Yeah, that's right. We have got a Facebook group that people can access as part of their support, so they can talk to other people online and see some helpful tips that advisors put on a weekly basis to update people what's going on and the benefits of stopping and anything that people are finding difficult. And it really helps that conversation and learning from others that are going through that similar journey. Because that's the only thing at the moment with not seeing people face to face. You can't see other people that are going through that journey, which I think is really important to learn from other people.
And if they want to get in contact with the services, I mean, I will post the link on this video as well. There's a certain email, or you've got the website. What's the best way to do that?
So you can do it one of two ways, really. You can either ring our service, which our 0800 numbers 0800 085 2299, or you can access through the Live Life Better Derbyshire website. If you just Google Live Life Better, it'll come up on Google. Click on there and take our health and wellbeing assessment, which will take you through a variety of questions, smoking being one of them, and then you'll be contacted by one of our Friendly Hub team to get you booked onto some support, and you can do that as quickly as you'd like. We're seeing people getting booked on the next day, 2 days time, dependent on the medical questions that we go through. Because sometimes we do have to inform your GP if there is some medication, for example, that you're on, that we need to inform your GP before you commence nicotine replacement.
So there's really no reason not to. Is there anything else you want to say in terms of the service that we might have missed out on?
I don't think so. I think the only thing that I can mention is about the carbon monoxide monitoring. So a lot of people really enjoy seeing their carbon monoxide reading on that first appointment and then seeing it reduce over time. But I know some people are disappointed at the minute that we can't actually do that because of COVID. But we will still talk about carbon monoxide and talk about the readings that typically you would see. So don't let that put you off. It's still really good to be able to have that conversation with an advisor and talk about the benefits that you would be seeing on that reading.
Yeah, so that's absolutely fantastic. So what I'll do as part of this podcast as well is I'll put the contact details and the website details on for people. Plus, obviously, you can get in touch with Royal Wellness Wellbeing anyway, myself. And we'll get all that information put online for people. But I just want to thank you for your time, Hayley. And I've learned some stuff as all I always do when I interview people on different subjects. So thank you for your time.
That's okay. No problem at all.
Okay, you take care.
Thanks. Bye.